What is Huntington's disease? Huntington's disease is an inherited condition that causes brain cells to slowly lose function and die. It affects the cells in parts of your brain that regulate voluntary movement and memory. Common symptoms include uncontrollable movements and changes to your thinking, behavior and personality. These symptoms get worse over time. What are the types of Huntington's disease? There are two types of Huntington's disease. 1. Adult onset. This is the most common form. 1. Symptoms usually begin after age 30. 2. Early onset, juvenile Huntington's disease. Early onset affects children and teenagers. 2. It's very rare. How common is Huntington's disease? Huntington's disease affects an estimated 3 to 7 out of every 100,000 people, most often people of European ancestry. Biological family comes from European descent. Symptoms and causes. What are the symptoms of Huntington's disease? Huntington's disease affects you both physically and mentally. Physical symptoms include 1. Uncontrolled movements like jerking or twitching, chorea. 2. Loss of coordination, ataxia. 3. Trouble walking. 4. Difficulty swallowing, dysphagia. 5. Slurred speech. Physical symptoms may start in small ways, for example, difficulty holding a pen, clumsiness or losing balance, and then get worse over time. In addition, if you have Huntington's disease, you may develop 1. Emotional changes like mood swings, depression and irritability. 2. Problems with memory, focus and multitasking. 3. Trouble learning new information. 4. Difficulty making decisions and reasoning. Your physical and mental symptoms may not affect your daily life much at first. But over time, these symptoms will make your usual tasks more difficult to do on your own. What is Huntington's disease? Chorea? One of the first physical symptoms of Huntington's disease is chorea. Chorea is unintended jerks or twisting movements. Chorea usually affects your hands, fingers and facial muscles first. Later, it also makes your arms, legs and torso move uncontrollably. Chorea can make speaking, eating and walking more difficult. It may affect your ability to perform everyday activities, such as driving, as well. What causes Huntington's disease? A genetic change, mutation, of the HTT gene causes Huntington's disease. The HTT gene makes a protein called Huntingtin. This protein helps your nerve cells, neurons, function. If you have Huntington's disease, your DNA doesn't have all the information needed to make the Huntingtin protein. As a result, these proteins grow in an abnormal shape and destroy, instead of help, your neurons. Your neurons die because of this genetic mutation. The destruction of nerve cells happens in the basal ganglia or the region of your brain that regulates your body's movements. It also affects the brain cortex, surface of your brain, that regulates your thinking, decision-making and memory. Is Huntington's disease inherited? Yes, you can inherit the genetic change, mutation, that causes Huntington's disease. You can develop this condition if one of your biological parents carries the genetic change and passes it on to you. This is an autosomal dominant pattern of inheritance. In rare cases, the genetic change happens without any history of the condition in your biological family. What are the risk factors for Huntington's disease? Anyone can develop Huntington's disease, but it's most common if someone in your biological family has the condition. If one of your parents has Huntington's disease, you have a 50% chance of also developing it. What are the complications of Huntington's disease? Huntington's disease is a progressive condition. This means that your symptoms get worse over time. Complications could include worsening symptoms, like 1. Dementia, loss of brain function, memory loss, personality changes. 2. Physical injury from involuntary movements or falls. 3. Difficulty swallowing, eating or drinking, malnutrition. 4. Inability to walk without assistance. 5. Infections, pneumonia. Children diagnosed with juvenile Huntington's disease may experience seizures. Diagnosis and tests. How is Huntington's disease diagnosed? A healthcare provider, like a neurologist, a doctor specializing in the brain and nerves, will diagnose Huntington's disease after performing a physical exam and a neurological exam. They'll look for symptoms of the condition that affect your movements, like twitches and jerking, as well as problems with your balance, reflexes and coordination. Your neurologist will also want to know if anyone else in your biological family has the condition. Often, you'll need a genetic test to confirm the diagnosis. Tests can rule out other conditions that cause similar symptoms and confirm a Huntington's disease diagnosis. Tests include 1. Blood tests. 2. Genetic testing. 3. Imaging tests, magnetic resonance imaging, MRI, and computed tomography, CT, scan. What is genetic testing to diagnose Huntington's disease? A genetic test is a blood test that looks for changes to your DNA. Your healthcare provider draws a sample of your blood and sends it to a lab to look at your DNA. The test determines if you have a genetic change in the HTT gene. A genetic counselor, someone who specializes in genetic testing, will discuss the process and results with you. Your provider may also ask if your biological family members can come in for genetic testing, too. This can help assess their risk of developing the condition or having a future child with the condition. Can you find out if you have Huntington's disease before symptoms appear? Yes. If one of your parents or siblings has Huntington's disease, your risk of having it is high. Predictive genetic testing, testing for genetic conditions before symptoms start, can tell if you have the gene change that causes Huntington's disease. People have different responses to learning about a condition they'll get someday. Knowing about the gene could help you make family plans and financial decisions. But it could also be emotionally difficult, especially since you can't prevent the condition. It's essential to discuss testing with your genetic counselor to see whether finding out early is the best decision for you. Management and treatment. How is Huntington's disease treated? Huntington's disease treatment focuses on helping you feel more comfortable. There isn't treatment available to stop, slow or prevent symptoms. Because this condition affects your physical, mental and emotional health, you may need several types of treatment, including 1. Physical therapy or occupational therapy. 2. Speech therapy. 3. Counseling. 4. Medications. What medications treat Huntington's disease? Your healthcare provider may prescribe different medications to address your symptoms. To treat chorea, common medications include 1. Tetrabenazine. 2. Deutetrabenazine. 3. Haloperidol. To manage emotional symptoms, your healthcare provider may recommend 1. Antidepressants like fluoxetine and sertraline. 2. Antipsychotic medications like risperidone and olanzapine. 3. Mood-stabilizing medications like lithium. At the end, it is requested you to please subscribe our channel.